Good morning. Today we are going to deal on a most important topic. So that is preventable, treatable, curable, and completely avoidable disease condition. So that is what we call as tuberculosis. It is in a short. It is called as in TB. So that is tuberculosis. So now coming to the history about the tuberculosis is very vast. It is not a new disease. In the Ramayana, Mahabharata time also, so the disease that is tuberculosis exists. The king, the son of king Vichitravirya also suffered and died resulting from so the tuberculosis. But the name is different. In that time it is called as the king's disease. Okay, now it is also called as consumption. The consumption. Because only one reason is there, the person loses its weights. It is for that reason, and also it lost his life due to the tuberculosis. For that reason, it is called the consumption. It means it takes a life. Now, it also we call as so it is Koch disease. Koch disease, because Robert Koch in the year 1882 the first time discovered, so that is caused to agent for the tuberculosis, that is Mycobacterium tuberculum. It is the rod shaped, the gram positive bacilli, bacillus positive bacilli, which for that reason is called as so Koch disease or a Koch phenomenon. It is also called as white plague or a white death. White plague or a white death. This because the person who is suffering from so that is tuberculosis, definitely they will they are having a low HB. Due to that low HB, that is hemoglobin level in the blood, okay, so they appears like a so that pale or a white in color, and also their diet resulting from so that is low HB. For that reason, it is called as a white death or a white plague. Now coming to the incidence of so that is tuberculosis in a globally, the incidence is very vast. In every year, so that the census of the 2024, so for every year the 10.7 million people they were suffering from tuberculosis suffered in the year 2024. Out of the 10.7 people, so that is 1.23 million the infected individual died resulting from so that is tuberculosis. So 10.7 only, so the suffer otherly 1.2 people they died because of tuberculosis. See how much that is the incidence is there for tuberculosis. Now coming to the Indian census in the year that is 2023 to 2024, that is the 3,23,200 people so died resulting from so that is tuberculosis. Out of so that is 42, so that is 50 lakh people suffered from tuberculosis. Out of them, so the 3 lakh 23 people, 23,200 people were lost their life due to that tuberculosis. And so that is in a day, for coming the incident about the so that is mortality rate of the every day in India, so that is 900 people were dying resulting from complication from tuberculosis. Right? So coming to this hourly, the every hour in India, so the 37 people were lost their life resulting from tuberculosis. See how much, so that is mortality rate is there for the tuberculosis. So by saying this, all this scenario, so the government of India has taken very most important, so that is strategy to reduce or to eliminate tuberculosis. But so the government of India, so that is planning very nicely, but in our population they are having a misconception about the tuberculosis. And most important aim for our side is to eliminate so the misconception about the tuberculosis. And also the government of India launched the new program, so that is National Tuberculosis Control Program in the year so that is 1962 for controlling and eliminating the tuberculosis in the year 1962. And also this the National Tuberculosis Control Program has changed names or revised. So that is National Tuberculosis Revised National Tuberculosis Control Program in the year so that is 1997. And also they are given so in the year that is National Tuberculosis Control Program they given importance to the BCG vaccination to the own individual. And in the year so that 1997 in the revised National Tuberculosis Control Programs they given the more important to the DOT strategy. So that is directly observed treatment strategy. So given health education to the people in the society. Alright, now coming thing, so in the 2020 year also the government of India planned very nicely for reducing and so that is identifying the tuberculosis patient and giving support to the that is tuberculosis patients who are suffering from tuberculosis. In the year 2020, they they started one more program, so that is Pradhan Mantri, so the TB Mukta Abhiyan. So it is also the most important Abhiyan to reduce and to eliminate tuberculosis from our country or our world. Okay, so this is about the what the clear cut, so that is brief introduction about the tuberculosis. So let us see, so the causes and so there is pathophysiology, the clinical symptoms and diagnostic evaluations. So what the treatment options are available in our India and world for the treatment of tuberculosis and complication of tuberculosis. Okay, see also we nursing officers what initiatives should take eliminating tuberculosis. Okay, so let us see one by one detail in the next class. Thank you.